Welcome to Muscle Research Review for the week of July the 13th, 2015. Quick research summaries for the very busy health and fitness professional. So let's begin. Does massage therapy have any short-term benefits for common musculoskeletal disorders? A new study did a systematic review of randomized trials. They had 26 eligible trials with 2,565 participants. And their findings? Well, massage as a standalone treatment did have short-term improvements in pain and function compared to no treatment. However, compared to other active treatments, no clear benefit was evident. Now, do you incorporate massage with your patients and clients? It would be more interesting to see the study looking at the length of time of each session, in addition to the type of massage given. In my experience, results vary greatly depending on whether the type and intensity of massage is aligned with the main outcome one is trying to achieve. Now, also, recent research does show that 60 minutes massage produces significantly different results than 30 minutes. Does patellofemoral pain lead to selective atrophy of the vastus medialis muscle? A systematic review from 2013 did show quadriceps muscle atrophy by imaging but didn't answer this question. A new study decided to expand on this. They compared 35 people with patellofemoral pain to 35 asymptomatic controls using real-time ultrasound. Now, the results showed that there was atrophy of all the muscles in the quadriceps in the affected limb of those with unilateral patellofemoral pain. Now, the results are showing that selective atrophy may not be present as previously thought. Focus on overall strengthening of the quadriceps may be more beneficial. If you're unsuccessfully treating someone for low back and buttock pain, a sacral fracture may be a differential diagnosis to keep in the back of your mind. A new study did a systematic review to find the associated risk factors that you need to be aware of. They looked at risk factors for sacral insufficiency and sacral stress fractures. For sacral insufficiency fractures, risk factors are as follows: osteoporosis, pelvic radiation therapy, rheumatoid arthritis, long-term corticosteroid therapy, and postmenopausal. For sacral stress fractures, the risk factors are recent increase in training intensity and deficient diet. It's common knowledge that eccentric training increases muscle strength and mass development. If you were looking for something to validate using it on your patients with health conditions, this study's for you. It takes a different view of eccentric loading and looked at early phase muscle adaptations to different levels of eccentric resistance after 8 weeks of lower body training. Now, 40 males training with supine leg press and calf press training 3 days a week for 8 weeks. Concentric training was consistent among groups. However, for the eccentric group, the groups were divided into 0, 33, 66, 100, and 138% of concentric load. Results were as follows. Increase in leg press 1 rep maximum was greatest in the 100% group and second in the 138% group. All groups except the 0% group increased calf press 1 rep maximum. Leg lean mass and greater trochanter bone mineral density increased only in the 138% group. Now, putting it into practice, an early phase adaptation to eccentric loading may be benefit to bedridden patients or individuals recovering from an injury. Now, bone density increases may be beneficial for those at risk of hip fractures. If you have any comments, leave it below. Also, make sure you subscribe to our YouTube channel for the latest findings in muscle research. We'll see you guys next week.